Right, Carlton King, the former Scotland Yard Special Branch and MI6 officer and the author of Black Ops.
I was undercover for Special Branch in a jihadi organisation.
If you'd like to help Carlton keep producing the Black Spy podcast and receive episodes and information that's only available to Carlton's special Patreon agents, then you can donate as little as £3, €4 or $5 a month by signing up with Patreon. See the Black Spy podcast notes or Google Patreon Black Spy podcast and pledge your monthly amount. You can even win the opportunity to be a guest on the show. Thanks for listening. And don't forget to subscribe for free.
My name is Carlton King, and welcome to the Black Spy podcast, the show that shines a light on the world of secret intelligence, national security, and armed governmental personal protection operations. But actually, more than anything else, what we actually do, and I say we, because I'm working once again with my number one colleague from the other side. I'm laughing because she's from the other side, i.e. journalism. The one and only Firgas Esack. Firgas, how are you again?
I'm going to throw a curveball here because I love that you said from the other side, right? Because I know I asked you last week off the record. I know I said to you about the new developments in the Maddie McCann case, which we've obviously spoken about before, and I said about the the clairvoyant that they've brought in, right?
Yes.
and I said to you, is this something that that frequently happens? And you gave me a great answer, which I'll let you narrate for your listeners, because every day is a school day with you, Carlton, as I keep telling people.
Thank you very much. What I did say is that, and I'll tell you, there's a very good program called something like, is it Sensing Murder? Something like that. I think it's Sensing Murder. It's an Australian program. But basically, it would appear that the Australian police, and that is obviously in their different states of Australia, have used this one particular psychic quite a lot. And then I looked at that because of what you said last week, and I looked through and I realised that the Americans, federal, so FBI, and the, what is it now? Is it 23,000 different police forces in the United States? Something like that. But, various numbers of them have used psychics. Now, in Britain, it's much more difficult to get hold of to see whether that is the case. But in those other two countries, they have kind of stated it, that they've used psychics just as and when there's basically nothing there. So I don't know if we've got, I've never used one, and I don't know a colleague who has. But then that said, I wasn't in general crime, so I'd have to speak to guys in the CID and see if they'd used, or Murder Squad or whatever, and see if they'd ever used that. I think they'd be loath to put that forward in the UK, purely and simply because of the hits that they take anyway when they do anything. So they can never do anything right. So I would imagine nobody would say. But in the other two countries that we just said, they have used them and are not negative in saying they have, because they basically add the rider that of course we look for evidence. So yeah, it's an interesting one, and as we said last time, maybe we'll look at that in a show. What do you think?
Well, maybe we'll look at it. Maybe we'll look at it in a theatre. Maybe. Your listeners would like to see us in real life. I don't know. Well, I mean,
that's an interesting one.
We were talking about. I know we were talking about this, and do you know when we do this? When we do these podcasts, I don't even have my video on, right? but I know what you look like, and your listeners, but
Horror of horrors.
but your listeners don't, and I just want to say to everyone that's listening, Carlton's a really cool guy, and you know, he rocks a smart suit, and he's pretty snappy, and you know, I mean, well, I'm a mum of four, but like, do you know what I mean? I can.
Hey, come on, let's give a compliment to where it belongs. Come on, you know what you've got.
My question is, like, would people like to hear us chat in real life?
Yeah, let's put that out there. Okay, so listeners, we're putting that out to you now. If you'd like to see and hear us chat in person at a venue of your choice, I'm just thinking, you're the one who knows how this all works. I'm just thinking, what would be the kind of venues? Dinner party? I don't know. What do you think? Give me a steer on this one, Firgas.
Would you like us up close and personal, or you know, at a distance?
Yeah, probably. Keep back. And of course you can ask any questions.
We could be behind bars and talk. No, but in all seriousness, would people be interested in asking us questions and having the opportunity that I am so privileged to have, where I ask you questions every week? Would an audience like to have that experience in real life? That's not a question for you and I now. It's a question for your listeners to add into the comments or message you or share on social media.
Brilliant. So please do message us, share on social media, come through to Firgas, come through to me. Doesn't matter either one of us. We work as a pair. We are, as you know, man and woman together, junto, working together on this issue from two different sides of the coin, I guess. Yeah. She is what's known as the fourth estate, you know, being a German. If you want to take it back to the times of the French Revolution. And I'm just, you know, a footman. Anyway, let's get into today's subject. What have you got for me?
Before we start selling tickets, before we start hustling, right, for what this could be, right, let's do the show. Let's do the show.
What have you got for me, kiddo?
Right. So now, look, we did touch on this in the last episode. We touched on this and we said we should talk about it. So we are going to talk about it. But let's start off by saying that when we referenced this in the previous episode, we were talking about the case of Lucy Letby, which is still a case that's in front of the court. So very tiny feet. Tiny feet. But let's just acknowledge here that anything that we say about this case is opinion.
Of course, it's all alleged. Tiny feet. Very careful. It's in court. So we have to be careful. Yeah.
It is in court. And another thing I'd like to start off this by saying is I'm a mother of four, and all my four children were delivered in NHS hospitals under difficult and complicated circumstances. But one of them went reasonably smoothly, but the rest of them were, you know, quite problematic. And I do personally have nothing but praise for the hard-working NHS nurses and doctors and midwives that brought my children into the world. So I'd like to start off by referencing that. However, as you so rightly pointed out last week, and you know, as needs to be stated, and I think we have mentioned this before. Murder. I mean, you know, let's give it a word. Murder.
Yeah, absolutely. Murder.
It happens on the NHS watch.
Yeah. And I want to forcefully say right in the beginning that the role of doctor, the role of nurse, my mother was a nurse, by the way, and, you know, if my parents would have wanted me to be anything, it would have been a doctor. So the role of doctor, role of nurse is one of those roles that, for me, is like a sacred thing. So I'm not being negative. What I have done, and people might realise this, that I've pointed out quite a lot of the time that the hue and cry there is about policing is somehow not given the same in terms of medics of all types, right? Doctors, nurses, whatever, right? So I find that grossly unfair, and I'll say why. Because the police, a clown within the police, that's what I'm calling an absolute idiot, has killed a young woman. So the fact that he was a police didn't particularly help him, although he said, I'm a policeman, but then anybody can say that. But that didn't help him, and he killed a woman. Another clown from the police has, in relationships he's had with women who then moved into his apartment, I believe, or house, or whatever it was, has then had some type of because he's done for several rapes. So they've been rapes of women, but also they've had some type of sexual activity that maybe is not the norm. But so that's aside. And again, I call these people both clowns and bad apples. So I contextualize that, but when I look at that those are two officers, and there are other officers who've done other things that are administratively different. So the latest one that people are shouting about is strip search, and I've got to say this now, Fergus, and I'll say it now, and I won't speak about the police again, but I'll say it now. Dame D'Souza has come out, who's the child commissioner, saying that children are being strip searched. Now, I'll put my cards on the table, right? I am not happy with this designation. It is a designation, so that's the way it is, but the designation of children. I like the old-fashioned terminology, children and young persons, right? Because, and this is where the problem lies, we're calling people children, and people who know my history, they know that I was in Afghanistan and I backwards and forwards all the time. They know that in various roles, right? So I've seen 17-year-olds who we're calling children for the purpose of a strip search. Now, I'm going to explain a strip search to you soon, but we're calling children, right? And they're in Afghanistan and they're in Iraq. They're serving on board naval ships. They're in the Royal Air Force as weapons assistance individuals, mechanics. They're even in the army. Now, I know a lot of the military said, oh, well, they shouldn't be fighting until they're 18. But I'm telling you, I've seen 17-year-olds in Afghanistan, in Iraq, as regular soldiers. I've seen that. Now, you can argue, oh, well, they maybe made a mistake, but they're there. Right? Now, the others are there because they're in a base where they think is safe, or they're on board a ship in the Gulf where they think is safe, right? But it's not safe, is it? Because they're in a war zone and actions can happen. So you've got 17-year-olds. In fact, they join at 16. So on a ship, you can be 16 as a weapons officer and be in conflict. So if they are children, then surely the military is grooming children to kill people. So what is it? Now, let's look at a strip search where they've gone crazy about a strip search. A strip search, an actual strip search, this is what the law says and what the police work to as to what is a strip search. It is a hat, taking off somebody's hat, a coat, right? Shoes, gloves, and what they call it is an outer coat, they call it, gloves. So not just a jacket, right? That's a strip search. So if that's done, that is a strip search. It's not like in prison taking everybody's clothes off and telling them to bend over and shout, what the prison service do. That's not what we're talking about. If it goes to that level, if it goes beyond what I've said, outer coat, hat, what I've said to you, shoes, etc., you have to call for the assistance of an inspector or above. A relatively high-ranked person. I was a detective inspector. Relatively high-ranking person. They're not just roaming around the streets. Right, so you're going to have to get contact with your sergeant, who may well be on the street, who gets in contact with the inspector and says, can I perform a strip search? Right? So people are not strip searching people in the open like that. It's not happening. And if it is, they're doing it totally against the regulations. So what you need to understand is when the police record that of a strip search, that is what they'll be recording. out of court jacket, blah, blah, blah. That will then be a strip search. So when Dame D'Souza gets her numbers of people who've been strip searched, that's what they are talking about. So it's complete misunderstanding. Now, the media, this is where I come back to your good friends, Firgas, should be explaining that to people, what a strip search is. Because otherwise, you're letting everybody think it's like some, as I said, some coffin thing like they have in a prison. And that's the prison officers doing that, not police. So that's what people are thinking. Quite rightly, people will think that, because why would they know any better? They don't know what the niceties of the law are. That's why I mentioned that. So this is when I'm talking about medical, and I'm talking about how medical people are treated differently, I'm actually explaining why is it that when I see, and we're going to talk about Lucy Letby, when I see somebody who's in court right now for murdering 10 people, not one, 10 babies in court now, allegedly, and a further 7 others, allegedly, because it's in court, I ask myself, why not the great hue and cry? Now, I guess somebody could turn around and say, well, it's still in court, so it's not yet been proved. But then I ask the points that they talk about on other issues. So they say, well, why in the police is this canteen culture and nobody comes forward? Well, actually, when we hear that doctors said, and this is actually come out in court, so you can take it for what it is, they've actually said 11 months prior to something happening, we don't trust this woman. She is there when babies are dying. This is doctors saying this to each other. And then they go to the management and say, we don't want her here because we don't think, and I'm quoting, it's a coincidence that she's present when babies are dying above and beyond the numbers they should be.
Well, look, let's
And just let me stop. You know what the management said?
Go on.
Oh, let's have a look at it. And the management didn't want to go to the police. And they've explained that. The management have said that. We didn't want the police involved. You know, it's bad publicity. We don't want them involved. So I asked myself the question, how does that happen? And later on, I'm going to tell you about all of the other, because 2-3 weeks ago when we were doing this, I wrote down in the notes some of, not all of, some of the other medics who had killed people within the last 20 years.
Well,
and you'll be
look, let me just pause you though, like because this is going to be great. Let's talk about that in a minute. But just rewinding back to your strip search thing, right?
Yeah.
Okay. The Guardian reported on Sunday, right, that there were 2,847 children reported as strip searched under police stop and search, right, between 2018 and 2022. So that's quite a big window. Quite a big window, right?
Very big.
Right. 95% were boys.
Mm-hmm.
Right. 42% were white.
Mm-hmm.
52% had no adult present.
Mm-hmm.
Right. 76% were aged 16 to 17.
72%. There you go.
Now, I think that's, yeah, exactly. So that validates your point. Now, flip to Nurse Letby. 58 children were murdered in a hospital environment reported last year.
Oh, it's frightening. It's frightening. It's frightening. You know.
Now, let's just so fast forward to your last point.
Yes.
About the reporting of the Lucy Letby case. The thing that I find morbidly, like, not morbidly fascinating, like those two words don't actually semantically scan in this. That's what I mean. But it's not morbidly fascinating. What I mean, you know, is what I found outrageously fascinating, I suppose, is the fact that the media, and again, I'm taking the hit for our team, but
yay!
I'm taking the hit for our team, right? Sky News. Now this is from last week. Actually, no. I'll read you. I'll tell you what the BBC said 5 days ago. Right? They said they spoke about the fact that they spoke about what had happened, right? But they referenced the fact that she'd fainted, you know, on the job. Nothing to do with the murdering of the children. She just fainted, right?
It's frightening.
Sky News reported a complete narrative of her text message conversation with the guy, with the work colleague that she was sort of seemingly flirting with, who offered her a lift home, who was obviously very supportive of her situation, and clearly was a colleague who cared about her well-being. But they quite literally published text messages where okay, I'll just read you a little bit of it, but bear in mind the whole.
Please do.
I'll read you a little bit to share with the listeners, right?
Yeah.
The doctor, who cannot be identified for legal reasons, asked Letby, "Have you been seen yet?" This was after she fainted, right? Letby replied, "Yes, just got back. I made a fool of myself whilst there." The doctor, who was also involved in the resuscitation efforts, said, "I asked them to be quick for you. How did you make a fool of yourself?" She said, "I fainted." He said, "You could have bleeped me. I'm almost a responsible adult. Do you need a lift home?" Anyway, I'll skip through the next bit, right?
Yeah.
And then he said, "That's not what you need. You need to look after yourself. Huge lectures aren't fun from your mum, like blah blah blah." I mean, essentially, they were just what's the word, like text flirting each other, right?
Yes.
But Sky News reported the whole conversation, right?
Yeah.
Hang on a minute. What about the dead babies?
Absolutely.
Now, again, as I say, like, this is with respect, and obviously the trial is still going on, but this did really shock me. The coverage of this story did really shock me. And previously, when we've sort of touched on this, I've got, but I felt as though this was quite an emotive subject. I wasn't sure how much of a deep dive we wanted to do into it, and I know it's something that you've researched a lot, and I know it's something that you know quite a lot about. But you just think, God, there's a baby. It's a baby. There's a baby. Absolutely. Right there.
Absolutely.
There's a baby right there, and so you've got that horror going on, and then, God, when was Harold Shipman, like 19?
Right. Yes, 1998 to 2000. Can actually started in 1975 killing people, which not a lot of people realise. He started killing people in 1975. It's incredible, isn't it?
That is, because that's a long. I mean,
absolutely. It's incredible. Can I put something to you and you come back on the argument? Because I think this is all about class. Now, I know with nurses, you can argue they're the working class people, blah, blah, blah. But they are tied to the medical profession, which are generally perceived as doctors and an upper middle class body. The reason why I mention this, you see, one paediatrician said about Lucy Letby, right? And I'm not laughing, but I have to because of the anger. He actually said to the management, Lucy Letby is a mortal danger, right? A mortal danger to the sibling of 2 dead children that she'd helped kill already. Now, he didn't say that she'd helped kill them, but 2 had died. She was a mortal danger to the 3rd. Now, I know I'm hearing a lot of politicians jumping up and down saying, oh, they said that this guy was Mr. Rapist in the police station, but nothing was done about him. Obviously a joke, that was his, rapist. He looks like whatever. That was his nickname, apparently. Whether he is or he isn't, it wasn't. It turned out to be, of course, in the end. But how do you get it to the point where a clinical specialist, a paediatrician, a mister, not even a doctor, so above that, tells his management she is a mortal danger, and they just want to put her back onto the ward, exactly the same ward? She actually said to the management, I find it boring not on that ward. This is just beggars belief. And then various others said...
Exactly. I mean, you know, exactly. I mean, there's... Like, look, and I knew this was going to be quite an emotive conversation, but you know, there are obviously so many members of the NHS who are heroes, who have go beyond above and beyond, right?
Correct.
To you know, to murder in plain sight, as it were, you know, it is obviously a route to serial killing for some,
yes.
if that's the route they want to go down. But they do need to have medical qualifications.
Yeah.
And so you sort of think, well, that there's a difference between a serial killer who sort of hacks up bodies and hides them in the woods, and someone who goes through 9 years at medical school.
Absolutely.
You know, it's got to be a very, you know, it's a very different mindset, isn't it? You know. Absolutely. And you know.
But the point I'm making is...
But also, I mean, Howard Shipman only murdered, in the end of the day, he only murdered 15 people, didn't he?
No. This is the beauty of it.
Right.
Look, in the end, this is the point. They're screaming out about vetting of police, and now they're talking about vetting of fire brigade. You know, the fire brigade is now the latest one in the angle. There's a fire brigade, and there's the ambulance service, right? So they've got them as well. So all sort of good working class little jobs. So originally, so they're in the firing line now, talking about, oh, they should be vetting their people better. They're doing this, they're doing that, they're doing the other. Right? That's what they're saying. And oftentimes it's about them making comments. So my brother's in the job, example. By that I mean the police, right? Now he is a good example of, you know, how things happen. He went to an incident, regular everyday incident, car crash. Fella's hit against the windscreen. When he pulls the fella back to help the fire brigade ambulance service, the fella's face comes off. Right now, so they make a joke. I can't remember what, somebody in the fire brigade made a joke about it. Blah, blah, blah. Right. I suggest to you that fire brigade person had seen this 20, 30, 40 times, whatever, and that's the coping mechanism. Yeah. Now, luckily for this fire fella, he hasn't put it on, taken a picture. He hasn't put it on WhatsApp. He hasn't done what, but this is a coping mechanism. These people are doing a job where they're seeing dastardly things that Joe Soap does not see. He doesn't see it. Right? He does not see it. And so when you do see these things, yeah, sometimes you have to cope. So that's what I'm saying with that. Now, let's get back to the medical and Shipman and your point of 15. He was put for 15 murders. Now, he started in 75. And in 76 already, and this is what's quite interesting, in 76 already, he was found to be cheating the system because he was prescribing to himself drugs because he was an addict. The medical council did not then, the GMC, did not say, General Medical Council didn't say, oh, you're off, mate, that's you done. Which is what would have happened if you were in the police, example. That's you finished, mate, you're out of a job. No, they gave him a written warning and said, no, bad man, don't do that again. Because he was falsifying prescriptions for himself. He'd already killed somebody then, 75. He then went on and kept killing people. And one of the first people who actually realised that it was normal was actually a gravedigger, who said, we're getting more people dying from that surgery than anywhere else. A gravedigger said it. They then went to the police. This is now after many, many years, 20 years, 98, and said, oh, this don't look particularly right. But nobody was going to the police before. This gravedigger went, some connection, and said, this don't look right. Because of who he was, a doctor, they basically took him at what he said. Oh, you know, it's just one of these things that happen. Sometimes these things happen. And when they actually spoke to a lot of the families of the people who died, even though they knew that nothing had happened to their loved one and their loved one was okay before he visited them, were still saying, well, he's a great guy, he's a great doctor, he looks after us superbly, he's fantastic. Even after he was charged later on that year, after police dug further, and he was charged, they were still saying, I don't believe it. He's a great guy. He's a doctor, pillar of the community. What got him was, and we don't know how often he did it, he falsified, forged to be precise. And this shows you the greed of him. This is why I think it wasn't his first time, but we don't know. He forged the will of a woman who used to be mayor of the town that he was in. That was his big mistake, because she used to be the mayor. She was a person of standing. The family were of standing. And you know what he did? Firgas, listen to this. He's that greedy, he took the whole 400,000 and wrote it over to himself and then forged the signature. He didn't just say, oh, I'll take 100 grand. He took the whole 400 grand she had left and wrote it over to him, said, oh, for my doctor who's been great, I'm leaving this to him.
Wow.
So
didn't even leave anything to...
No, nothing for the family.
If you left 5 grand for the cat's home, he'd have probably got away with it, wouldn't he?
Nothing. This is what makes me think it's not the first time. So obviously the daughter said, hold on, when the solicitor said, this fella's not been treated all this long time. And she looked pretty healthy to me when she saw him. And it was the daughter who then went to the police. So again, class, a higher ranking person went to the police, not just now the gravedigger, and said, listen, this fella's not doing something right. My mother would never have left him all of her money. And that's when the police started digging properly. Do you see what I mean? So class played a factor every time.
I do. But actually, like to your earlier point, and and again, this is just such a grey area that just that needs more conversation and needs more exposure. There was I think the Care Equality Commission put out a report last autumn, maybe like September, October or something, and they essentially said that like 2 out of 5 maternity units in England are providing substandard care to mothers and babies, and that there are obviously there were loads of sort of shock stories about babies that died that shouldn't have died, and I mean, so I guess that there's a question in my mind always about premeditation or mistake.
Right, I'm aiming off on them.
And
I'm not even mentioning those. What was the one hospital that was mainly? I'm not Leicester or something like that. I'm not mentioning those where it could be something. I'm only mentioning murders. In Shipman's case,
we are only mentioning murders, right? But
he murdered 250.
But I guess and like this is like the dark side talking. But does one lead to does one lead to another? Or
I know what you're saying. I don't want to go there.
Or is it premeditated? Like, I mean, I
don't want to go there.
I would say, I would speculate. Like, look, Shipman obviously had a game plan. Like, I mean, to go to that length to forge a will, and I mean, there's loads of. I mean, he wrote a book, didn't he? And then, there's loads of stuff about how, like, he sort of watched his mum pass away, and loads of stuff. So maybe that was sort of premeditated. I mean, circling back to Lucy Letby, and obviously we've got to be careful about what we say.
You've got to be very careful on it.
But was it a mistake? Was it a repeat mistake?
No.
Or
that.
Was it something that or was it something that was just a kind of easy thing? I mean, just to give you a personal anecdote, and this is not meant with any sort of malice, because as I said before, like the maternity staff that delivered my children were incredibly kind. But out of the 4 boys that I delivered, I suppose, that I've birthed, I've had 3 epidurals, right? When you have an epidural, you have to sign this thing, and it sort of says, oh, do you know what I mean? There's 1,000,000 to 1 chance, or I don't know what the odds are, but you sign the thing, right? And it says like, look, there is a chance that if we get the epidural in the wrong place, you'll end up paralyzed.
Yeah.
Right. And you sign it because you're just in loads of pain and you want the baby out, but you sign it, right? And 2 out of the 3 epidurals that I've had, what they don't tell you is, sure, there's a percentage chance that they get it in the wrong place that you end up paralyzed, but 2 out of the 3, they got it in the wrong place so that it didn't actually kill the pain.
Yes, got you.
So they just quite literally got it in the wrong place. Right. Now, again, I'm sort of saying this with love, but obviously it was an error, right? Right. Now, but for the grace of God, like, do you know what I mean? Like, they got it in the wrong place. So I could have quite easily ended up paralyzed, and I would have already signed that form to say, oh, it's all right if you leave me paralyzed. Yep. Do you see where I'm going?
No, I know exactly where you're going. This is why I said my mother was a nurse, right? In the good old days, when obviously things happened and nobody said anything. So what I'm saying is this: I aim off for all of that. There could be 1,000,001 murderers hiding behind it was just an accident. I'm not even going anywhere near that, because these people save lives, and accidents can happen, and they're on duty for 12 hours and they wake up and do something and it's wrong, blah, blah, all goes wrong. And I know that from the other perspective, from, my type of work, where you can make a wrong decision and, anything could happen. Let's say I was after some fellow who's a terrorist or whatever, and he's creating some sort of mixture, and I get the wrong intel in the wrong way, and we don't follow the fellow, and he blows people up. This can happen. So I'm not going there. What I'm going to is actual people creating murders, and if you remember when we did the bully one, which I thought was fantastic, you said let's do the bully one, and after when I was doing the notes, I looked it up because I hated the way the superintendent female was treated just because she wore a dress. And I thought to myself, why? So I looked up the medics, didn't I? And I put on the notes about medics who had killed people, not mistakes, killed people. And remember Miss Beverly Allett killed numerous babies in Grantham?
Insulin, isn't she?
Absolutely.
Yeah.
You got it in one. Yes, bit of hue and cry, but where were the challenges against the system? Like they get the commissioner up of police and they say, Commissioner, you've done a bad job and you need to do this and all police are terrible. Where was the hue and cry with the health service saying, what have you done? None. Right. I also looked at Factor 8, okay, that has killed 20 to 30,000 people. Okay, because they basically still put Factor 8 in and give it to haemophiliacs in the English and Wales Health Service. Now, let's take 10,000 of them off. And the reason why I'm taking 10,000 off is, let's say, before they realised that what was happening, that they were buying this Factor 8, which is what they use to help clot the blood for a haemophiliac. They were buying it from the States, and let's say they didn't know about HIV properly at the time, and they didn't know that people were selling the blood in the States, and therefore a lot of needle sharing had gone on, etc., right? And that was being sold with that, and people were getting HIV and dying, right? But once the Scottish Health Service, part of this Great Britain that we have, once the Scottish Health Service said, we're not going to use this Factor 8 because, and then says why, because they are people who are using needles, sharing needles, etc., who have got HIV. It's not tested for in the States and it's killing people. We're not going to use it. We're going to pay for the more expensive stuff and create it ourselves. So the Scottish Health Service wouldn't take it. So after that time period, surely when we were still taking it in England and Wales and people were dying, surely somebody's got to answer for that. No. Just very, very recently, take into account, that's back in the 90s, 80s, 90s, very, very recently just had a couple of cases on about it, and they had 2 of the main protagonists, one being Sir John Major, who was at the time the Prime Minister, and the other one being, what's he called, loves jazz, I like him, but anyway, he was the health secretary at the time. None of them wanted to take any responsibility for it. And nothing happened to anybody for it happening. And they've just about started to pay people out now for their fathers, it's generally men who get it, haemophilia, for their fathers who've died, sons who've died, parents who've died, etc., etc. Right. So that's another one in the health service. Then Nurse Colin Campbell Norris, right, murdered 10 of his patients. This is all in the last 20 years. Murdered 10 of his patients, right? Murdered them, right? And attempted to murder at least one other. Because when it's these attempts on murders, because a lot of these people, you know what they're doing? They're injecting people with air. So you can't tell if they've actually tried to do something. So you can only really get them for the actual murders. So there's probably been as many attempts, if not 10 times as many attempts, as there are actual murders. That's another nurse in the United Kingdom murdered people, right?
Yeah,
then we had Miss Benjamin Dean.
I was going to say,
I'm just going to go through them. I'm going to go through them, and then we can talk.
Do go through them. Do go through them. Do go through them. But like Beverly Alliott, right? And like, you know, I know about her because I grew up near Grantham, and she was that's like where she was from, right? And
Yep.
And one of the kids, like there were some twins that she murdered, weren't there? And one of them, like the parents even made her the godparent because they were so grateful of how she looked after. So it's, you know, it like. Yeah, I mean, yeah. Go on, carry on.
I'm coming on.
But it kind of beggars belief because it's not like this is so different to like. I mean, even when you look at terrorism, or you know, when you look at like you know a lone gunman who goes loose on a primary school or something like that, right? They've got a plan. There's almost like a formula. It's I mean, you know, I hate to use the media expression copycat murder, but you know, whatever. But I think the thing about these is that it isn't. None of it's copycat, is it? It's like,
I'd say they're planned. And the reason why,
but it's not like they're saying, okay, here's a formula. This is how you do it. I mean, these people have gone to med school for X amount of time, or had
they can inject anything into
training.
Absolutely right.
You know,
absolutely right. Absolutely.
You know,
right.
yes. Some people might be doing it. You know, might be using air as their weapon of choice. Some people might be using insulin. Some people might be using like other prescribed drugs. Other people might be, but do you know what I mean? This isn't like you know. Oh, I saw this on TV last week, so I'm going to do it.
No,
you know,
this is thought through, and I don't know why.
This isn't like I'm part of a, you know, this isn't like I'm part of a, you know, a terrorist organisation trying to bring down the NHS.
Yeah, I see what you're saying. There's not a reason for it, is what you're saying. I'm with you. I'm with you on that. I mean, don't get me wrong. There wasn't a reason, so we keep it fair. There wasn't a reason for that guy killing. What was the officer who killed the lady? Yes, David Carrick, isn't he? The officer I'm thinking of, David Carrick. Right. The thing is, that's one officer doing this. I'm just still reading out to you, and that's one murder. I'm still reading out to you more murders. So we got another murder. We got this guy Benjamin Dean. And these are all murders. So they've all gone to court, all been found guilty, murdered at least 2 patients. And when I say in Oxfordshire Hospital, now when I say at least, it's because they can't prove anything more, right? At least 2 patients. And there were other victims that sustained grave life-threatening symptoms because what he did, he injected them with certain portions, which actually left people very, very badly off, even though they didn't die. Then we had Nurse Victoria Chow. So he's the only one who isn't a Brit, because he came from, I think, Philippines to Britain and was brought onto the NHS. And this guy was at Epping Hill Hospital, and he murdered 2 patients and has 21 other potential murder victims, some of them suffering life-threatening hypoglycemia attacks at his hands. Right, so that's another one. And there's more of that. But then I thought, no, let's not be unfair. Let's not just look at nurses. Let's look at doctors. Right, so obviously we know about Shipman. We've been speaking about him, right? And we know these are like at least 250 people. Some are saying 500 people he murdered. And the reason why many people say, I don't want you to exhume my family. Or what he put on, you know, the woman that I said right in the beginning who was the mayor actually, he put on her death certificate, and this is why they can't give all the numbers. He actually put on the death certificates on many of them that they shouldn't be buried, that he wanted them to be cremated. So he put that on her death certificate. See, and he'd done that with various others, to be cremated, so there's no evidence. Right? So you got to look at that. And then others didn't want their loved ones dug up, which is understandable. Right? So then you had Surgeon Simon Bramhall. Now, this fella didn't kill people, but what he did do is he used to sign his initials on patients' livers. Now, and by the way, remember the 2 officers we spoke about? Their actions are not on duty. All these fellas are doing it whilst they're on duty. So you're going into hospital to be dealt with by nurses and doctors, and these people are carrying out actions against you whilst they're carrying out their duty. Right? So it's not as though they're just cursing around the streets looking for somebody like that rapist was or whatever. No, these fellas doing it on duty in the NHS. So I asked the question, why are the NHS not being brought up and being asked about what is going on with all these murders? I mean, I was shocked when I saw the numbers. So this guy used to, on the livers of people, used to do his initials. So he had another one, Surgeon Ian Patterson. These are surgeons. These are top class people. Surgeons who was found guilty of operations on countless patients, mainly women, for seemingly no reason. So what he was doing was disfiguring them by removing their breasts, etc. And allegedly, nobody knows why, it was done for financial gain, according to the relatively little press that was spoken about. So this guy was basically mutilating women for no reason other than he gets paid for every operation. I mean, this beggars belief. And literally, they're talking about it potentially being hundreds upon hundreds.
So that was part 1 of this week's Black Spy podcast. And hope you enjoyed it. We'll have part 2 next week.
If you'd like to help Carlton keep producing the Black Spy podcast and receive episodes and information that's only available to Carlton's special Patreon agents, then you can donate as little as £3, €4 or $5 a month by signing up with Patreon. See the Black Spy podcast notes or Google Patreon Black Spy podcast and pledge your monthly amount. You can even win the opportunity to be a guest on the show. Thanks for listening, and don't forget to subscribe for free.
Here is a working class spy telling his stories, the secrets, the lives of spies. Feel free to message Carlton King on all socials and give this show 5 stars on Apple iTunes and subscribe so you never miss a single episode. For your ears only.
In the quarter of a century, I was a member of Her Majesty's Secret Intelligence Service.